Hi, my name is Rosalia Contreras and my topic is Therapy for a Rare Genetic Disease. Definition: Genosequencing is often pivotal in the diagnosis of rare disease, but many of these conditions lack specific treatments.
Coming up on that 2-year anniversary, I'm just thankful that we were able to overcome all the obstacles that we went through and as a family begin to grow and put this past us. I had Olivia on May 4th at 10:22 p.m. I was in the hospital for 2 days and I remember everything up until the third day I was home is when the confusion started, the delirium, the agitation. We went to the OB's office. She immediately sent us over to the urgent care, and I was still confused. I didn't understand anything. They would ask me questions like who the president was, and I didn't know the answer. Multiple times I lashed out, was yelling, and I was trying to leave, and they had to restrain me. I started to develop hemolysis, and so my blood was destroying itself. And the doctors here told my husband and my parents that I wouldn't make it through the night without the blood transfusion. And I got approved for a transfer at like 4 a.m. And so around 5 in the morning, they came and got me and took me to UT Southwestern.
We're lucky here to have a program called the Genetic and Metabolic Disease Program, and it allows us to identify families with rare and undiagnosed genetic diseases. She has a disease that's in a group of diseases we call the urea cycle defects. So the urea cycle is basically how the body deals with waste that is generated when you break down proteins. Sometimes we break down the proteins and use them for energy. When we do that, it creates nitrogen, and that nitrogen actually builds up as ammonia in the blood and can be toxic. So the way the body gets rid of that is through a chemical process that we call the urea cycle. There's a broad spectrum of how these diseases can present clinically. In the mild cases, yes, they do fine until they encounter a serious stress, and that could be something like childbirth.
That is why mine surfaced, is because I had Olivia.
She's lucky in one sense that of the genetic urea cycle defects, she has the one for which we have essentially a curative medication. None of the others, we have a medication that's quite so effective. And so she was able to get that medication.
I feel very thankful that we're able to pinpoint the disease and get the correct help and medications that make me lead a normal life.
While she initially required 22 pills a day, which is a lot for anybody to take, now she's down to taking just 6 a day. As long as she's on the medication, we don't expect that she would have the kind of problem that she had that brought her to the hospital initially. But if she ever went off the medication, she would be back at risk for those problems.
UT Southwestern Dr. McNutt saved my life. That's why I'm here with Olivia today.
Applications in medicine. We describe how molecular diagnosis of a rare fatal neurodegenerative condition led to the rational design, testing, and manufacture of Milancet, a splat-modulating antisense oligonucleotide drug tailored to a particular patient.
So there's a couple issues that arise in that situation. One is the disorder so rare that it's not being recognized by the clinician, but it's a known disorder. I mean, it's been described before, but it's just very rare. That's one situation. The other situation is, in fact, it's a new disorder. It's genetic, but in fact, it's not been described before. And so the approach to the diagnosis in these two situations is different. In one case, if it's a known disorder, what you want to do is do a high-quality genetic test that covers all the genes that are known to contribute to that disorder. I mean, for example, infantile epilepsy. There are hundreds of genes which, when mutated, can cause that condition. And what you'd want to do is test for all of them. On the other hand, there are situations where you suspect the patient has a genetic disorder, but it doesn't fit any well-known clinical picture. And there, I think the use of whole exome analysis has become much more common as a way of essentially sequencing thousands of genes, even up to 20,000, every gene in human beings. Sequence all of them and see if you can find an alteration which explains this previously unrecognized or unknown condition. And both of those are now being used in the rare disease situation when people have gone without a diagnosis.
Pros and cons. There were no serious adverse events, and treatment was associated with objective reduction in seizures.
In Health News tonight, a new therapy for a rare, devastating genetic disorder.
And it can be life-threatening for people diagnosed with it. News 8's medical reporter Jocelyn Memento live tonight in our New Haven newsroom with the very latest on treatment now being offered at Yale New Haven Hospital. Jocelyn?
And I'm talking about Gaucher disease, estimated to affect 1 in 40 to 60,000 people and often misdiagnosed. Early diagnosis leads to early treatment and prevention of dangerous complications, which now includes the first oral medication. Tamara Siosi was just 18 months old when she broke her hip.
At the time, it was written off as a really freak accident.
Years of chronic bone pain, weakened immune system, and an enlarged liver and spleen baffled doctors.
They would speculate maybe it's an autoimmune disease, maybe it's rheumatoid arthritis. Some people thought I had leukemia.
Finally came the diagnosis of Gaucher disease, a rare inherited condition due to a defective enzyme whose job is to break down fatty substances.
When the enzyme is low, the lipid material that is normally broken down by this cell begins to accumulate in cells of the body.
In Tamara's case, it led to an abnormal sized spleen and liver.
Massive enlargement of the liver and massive enlargement of the spleen here.
20 times larger than normal, and a bone marrow not making new blood cells. The FDA recently approved the first oral drug for Gaucher, and well-known specialist Dr. Pram Mistry at Yale New Haven Hospital, lead investigator of a clinical trial that investigated the drug, is now able to offer it to patients like Tamara.
This is a drug that reduces the amount of the lipid that accumulates in Gaucher disease by inhibiting its production. And uniquely, this is a treatment that affects all cell types of the body.
Now the size of Tamara's spleen and liver have shrunk considerably. So has the bone marrow. A welcome treatment after 20 years of enzyme replacement every 2 weeks.
They would say, I don't know if she's going to make it to 30, and then I don't know if she's going to make it to 40. But then with enzyme replacement and now Sardelga, it's rewritten where I'm at now.
A wife and mother of 2.
In spite
Issues. There are no therapies for a rare genetic disease in Ecuador.
Your Health tonight, the first gene therapy for a genetic disease in the United States.
And as News 8's medical reporter Jocelyn Memento explains, it has a Connecticut connection.
A number of firsts linked to a treatment designed to improve the sight of a patient's rare form of blindness. A Connecticut advocacy group was among those at the forefront of getting the FDA to approve it. You first met Sophia Preby when she was just 10 years old in a story raising awareness of her rare degenerative genetic condition. She was born with severe vision loss that can lead to total blindness.
It's hard to see things that are far away or when it's really bright out.
Mom Laura Manfrey co-founded Sophia Sees Hope soon after, an advocacy group transforming the lives of those living with rare inherited retinal diseases, IRD. Her testimony before an FDA panel helped pave the way to the approval of Luxturna, the first drug treatment for people with IRD. And there's more.
This is like the moon landing for science. This is the very first genetic therapy for genetic disease. approved for market in the United States.
But Sophia, now 14 years old, will not be among those who will benefit.
This treatment is not for her gene. Her gene defect is unfortunately a little bit more complicated.
Patients who can take advantage of it will be injected with the drug.
With Luxturna, we are finding that we can actually restore, to some degree, vision. Now, again, at early stages,
Dr. George Adrian is on the board of directors for the nonprofit.
correctly codes the defective genetic sequence and restoring the photoreceptor integrity so the eye can function again.
The hope is the research behind the breakthrough treatment will lead to developing drugs that could someday help other patients like Sophia. The FDA approval underscores
Conclusion. Over the course of treatment today, Milancet appears to have had an acceptable side effect profile with no safety concerns.
You want to see the team first before we go in?
I was diagnosed with glycogen storage disease when I turned 9 months old. My liver was the size of a basketball in my stomach.
Jared is a patient who contacted me about 5 years ago. He was not doing well. He was giving up hope because his health was deteriorating.
I lived in and out of the hospital, and it was like that my entire life. I had to struggle at school. I had to struggle with everything in life.
Glycogen storage disease is a disorder where sugar gets into the liver but can't get out. With advances in care, people are doing much better. Complications are disappearing, but there's one problem. They have to be perfect. In this disorder, cornstarch is given every 3 to 4 hours. And any time a dose is delayed or missed, the blood sugars fall and they can have a seizure or die.
I can't make a mistake whenever it comes to this cornstarch regimen or my diet. Because, if I do, that could be my life.
Even to this day, even though with all the advances in treatment.
Thank you.